Assalamu alaikum and welcome to Medicower. I'm your host Rabina Mia, and today's subject is very much about your kidney health. In the hot seat we're welcoming back Dr. Raj. Thank you for joining us again, Dr. Raj. Okay, so we want to learn all about our kidneys today. We've got two of them. Why have we got two?
So why have we got two kidneys? It's a very, very important question, and I think it's one that we don't really know the answer to completely just yet, in all honesty. It seems like throughout the whole of all of biology and all the other animals that we know of, and whether you believe in evolution or not, it doesn't make a difference. But
we
most
don't,
of these, yeah, that's fine. But a lot of them have, a lot of animals have two kidneys, and we have also got two kidneys. Luckily for us, technically we only need one kidney to work and function normally, but we've got two. I suppose it's the most likely reason is probably it's a security measure in case one doesn't work properly, which is quite common. At least you've got another one to help with some of that workflow that needs to be done.
Okay, so let's go back to basics then. So what are your kidneys and what do they do?
So you've got two kidneys and they both live right up in your back up here, right at the top. Which is actually quite surprising because people always think they're kind of low down or something, but they're actually quite high up, and they're just under a big sheet of muscle called the diaphragm, which separates your chest from your belly, and it goes all the way across and it separates the two spaces out, and your kidneys live just underneath this big sheet of muscle. So when you breathe and you breathe in and out, your diaphragm muscle actually goes up and down, and your kidneys move up it with that as well. So they go up and down a bit with that. But they're situated just at the top, and they've got quite a very, very rich blood supply. So lots of blood going to your kidneys really quickly, and it's able to. The main function of the kidney is the main function. There are multiple functions, but the main function is it works as a filter.
So when you were talking about the liver earlier, you were talking about in the last program.
Yeah. So the liver is what's filtering stuff that's going into your body.
Yes. The
kidneys are working the opposite way. So they work as a filter to see what we need to push out of the body.
Okay, so the waste.
Yes. So they kind of work in tandem with the liver. And a lot of people that have liver problems can develop kidney problems as well for different reasons, but they work in a very similar way. And what the kidneys basically do is all of your nutrients in your blood that has been carried around, the kidneys are really, really intelligent, and they know stuff that is good for you and needs to stay in, and they know stuff that's bad for you and needs to leave. And through the process of living and through the process of doing what we do on a level kind of under a microscope in your cells, we all produce certain chemicals and toxins that
are like poisons.
Yeah, poisons that aren't good for you, and we need to get rid of them. Unfortunately, those things are just a normal byproduct of living. So your normal processes that keep your cells alive and keep you going, give you the energy to do all the things you do. Those things unfortunately have a byproduct, which are these kind of horrible chemicals, these poisons, that if they build up in high enough quantity can make you feel sick, and they can make you poorly. So your kidney's job is to identify those and get rid of them.
Sounds a bit like a purifier.
Exactly, yeah. So it's like a purifying unit for your body, and it's quite amazing how many litres of blood that each kidney can process per hour, and by doing so, it filters out all of the rubbish, it collects all the rubbish, concentrates it, and then actually it's got other systems in place that actually mean that it can recheck stuff that it's lost and make sure, and if there's anything that is missed, it will get it back at a further time before it leaves your body. And then basically, once the kidneys have concentrated all this rubbish, these poisons, they make something, they dilute it in water, and they make urine, which is what we pee out. And all of the stuff that the kidneys produce that we don't need goes out in the urine, and then it's flushed out from your body. You don't need it anymore.
Urine varies in colour.
Yeah.
And is that to do with the kidneys, or is that to do with something else?
Completely, yeah. So the kidneys serve a really, really important function, and the kidneys are also like a water balance center for your body. So at times when you are really dry and you're thirsty and you've just not got enough water in your body, you're dehydrated is the word we use, then the kidneys are actually really sensitive to those changes, and they understand that when we are really, really dry and we don't have enough water in our body, we don't want to pee loads, we don't want to urinate loads and lose extra water. So what they can actually do is they can concentrate the urine, make it more concentrated, give less water into the urine, which means it makes it darker, and they'll pull back that extra water, reserve it, and send it back into the blood to try and keep it where it needs to be, rather than lose it into a loo, which is not what you want when you're dry and you're dehydrated.
So if you're keeping your kidneys healthy, is there a particular colour that your urine should be?
So we normally advocate a really light straw colour is normally the the best colour for your urine.
That's like a light yellow colour?
A really light yellow. So I mean, but the thing is it's really variable, and people have like, people drink loads and loads and they have like kind of completely clear urine that's just kind of like a glass of water. And that's really good, but it probably just means that they're, it's good for them. It means they're hydrated, but it just means that they're peeing out water again, which is, to keep an optimum and to keep it kind of realistic. A light straw colour is the best kind of light yellow colour. If it starts to get darker, you just need to see it as a sign that probably you're not drinking enough fluids.
Yeah, that's what I always understood from it. So yeah, nice to have that reassurance that I've understood that correctly then. Thank you. So how do we keep our kidneys healthy? It sounds like water is one of the things that we need to have.
You might, I know we've had a chat about this before, and you might have disagreed with some of my other guests, but about this particular topic. As a medic, I would say that any fluid is better than no fluid.
I think that's what she was saying.
Yeah, any fluid is better than no fluid. If you're going to be, if you're going to go against all advice and not drink any water, and some patients do that and they don't like water.
I know people that don't like water. Absolutely, they have juice all the time.
Some people don't like water, and that's okay. But it's the ideal stuff for you. It's the best stuff. But sometimes it's not what everybody wants. And in that case, if you're struggling with water, then we'd advocate, if you want to put in some kind of squash, like to dilute it down a bit and make it a different flavour. That's okay. Like, do what you want to do, as long as you get the quantity. That's the most important thing. It's slightly more grey when you get to things like tea and coffee and Coke and stuff like that, because everyone goes, I drink like 5 cups of tea a day, which is good. You're certainly getting a level of fluid, which is what you need. But sometimes with those kind of drinks, they have a level of caffeine in them. Yeah. And caffeine can actually it can be counterproductive for you, because it can actually, what it does is it sometimes acts on those little the sensors inside your kidney that tell you that actually you're probably overhydrated, and actually get you to pee more than you would. So you actually end up losing more water in your urine. It's difficult to say whether 1 cup of tea means, you can't quantify it like that, but overall it means that it's less effective at hydrating you than a glass of water would be. It means you will be losing a bit more in your urine.
So I guess, whilst you'd advocate for people having more plain water, if you're struggling with that, fluid of most types is probably still better than none.
Better than not having fluids, which is the most important.
Are there any fluids we should really avoid?
I think...
I know you've touched on the caffeinated ones.
Yeah, so caffeinated things are important, but I mean, there are modern day drinks that we tend to...
that the young people are all on when they're on exams, all these fizzy energy drinks.
Yeah, and when I was young and stupid, I was also in that camp as well.
And I know some young people that are doing a lot of that, and I just don't get it.
So those drinks that I'm not going to mention any names, but those branded ones. Those branded drinks that help
you fly and all the rest of it.
I think, it's probably giving more information than we need to. I'm sure,
and other brands too.
Other brands too. There are multiple brands. They've got very good marketing campaigns.
They have.
That make people nowadays are savvy and they understand things, but they're also susceptible to branding, and we are all susceptible to branding, and they have very, very good branding, which basically makes sometimes it look like it's making a benefit for you. It's giving you some benefits.
Well, in my day, the energy drink was Lucozade that you used to take into hospital for anybody that was sick, and now we've got these energy drinks that are for other purposes.
So Lucozade again, there are other
There are
brands
brands as
available. That one that we've just mentioned is probably slightly better than some of the others, because the way that Lucozade was actually made initially, it was made to match. In medical terms, we called it isotonic. That's the word we use.
Oh, that word's come back in,
I'm
hasn't
sure,
it?
yeah.
Yes.
But so that word basically means it's the same. They try to match what's in your blood and try to make it as equal to your blood as possible in terms of the different salts and the different sugars. And I appreciate there's probably more sugar in there than there should be, because obviously you need to. Otherwise, no one's going to buy it if it tastes like But those are probably better for you in terms of their quantity of salts and their quantity of energy is more like what your blood is like. And that's what it was originally made for. I think over time, their marketing has also changed, and it's now geared up more towards the kind of the sports element.
Yes.
And sometimes actually it makes it seem like if you are a sporty person, then you should be drinking these drinks. But actually, it can be probably not that, well, I know that it can actually be detrimental to your health. It can give you negative consequences, because the amount of energy that's in those things, it's actually for people who are doing like marathons. You know, that's the kind of energy that you'd need to just sustain yourself over a long period of time. Because the amount of sugar in them.
This is why students are drinking them, because they're drinking them a lot around exam seasons, and that's what worries me.
So those are the kind of the sporty drinks. The ones that are kind of like, you know, that give you wings drinks. Yeah. Those ones are targeted actually to make you get like you have more energy and stuff. Probably
alert, stay awake. I
mean, they're not. As far as I'm aware, they don't target them specifically for kind of a sporty person, but just generally. But unfortunately, those things just contain so much sugar, so many horrible E numbers and chemicals that unfortunately your liver and your kidneys have to deal with. But also, one of the key, as far as I'm aware, I may be wrong, but as far as I'm aware, one of the key chemicals in there that they quote containing, which is called taurine, is actually there's a lot of research to say that actually it's probably not that useful for you, and it's a chemical that you can't really actually use.
Sounds like you'd be better off just putting sugar in water.
Well, it just becomes, to put simply, it just makes it very, very expensive pee. You're making very, very expensive urine that you don't really need to have. Or
so all you young people out there, take it easy.
So yeah, I mean, it'll give you a bit of a rush, you know, but a cup of tea with a bit of sugar in it would give you the same.
Okay, so there's the views of different sorts on that, I imagine.
People will probably disagree with me on that,
well,
that's
I think,
fine.
No, I think I'm totally in your camp personally, but then I am of a certain generation now as well. Let's come back to the kidneys and its specific function and health. So what can go wrong with our kidneys?
So kidneys are really, really, they've got a vast profile of what they do. And because of that, unfortunately, over time, their function can deteriorate. And one of the key principles that we want to get through to everyone at home today is the fact that some people have kidney problems, and that's normal. That can happen with age. It's as you start to age, you know, you're on the external surface, you've got sagging skin, you know, you get wrinkles, you get age spots, you age, everyone ages, you get grey hair. The same principles and same effects are happening internally as well, which we all forget.
So we're wear and tear.
So yeah, so kidneys are getting scarred, they're long-term kind of aging processes, there's wear and tear, long-term problems, and everyone's kidneys will eventually, if you kept on going and going, kidneys stop working. But the rate at which that happens is what we want to try and control.
Sure.
So an aging kidney is a normal process, and having if you ever go to your doctors and they'll do some blood tests to check something called your kidney function.
Yes.
And all that means is that we're trying to see how well your kidneys are able to process the salts and process those toxins, those poisons that we talked about. Because they are really, really key in trying to move around your salts. And your salt balance is one of the key functions of the kidney. Because if your salt balance is off, it can affect, there's two major salts that we're talking about. There's one called sodium and there's one called potassium.
Right.
Those are the key ones. There are others, but those are the key ones that your body needs.
And are they just coming through your diet, these, or they come from other sources?
So they're from your diet, but you can actually generate some of those things yourself as well.
Okay.
That's a bit too complex probably, but for the sake of what I've used at home, sodium is normally in really high concentration normally in the blood, and potassium is very low concentration. There's less of it. There's lots of sodium and a little bit of potassium. The actual values in terms of what's normal and how much you should have, they're really tightly regulated.
By the kidneys?
By the kidneys, and other mechanisms as well, but by your kidneys specifically. If your sodium level goes up too high or too low, it can affect the way that your brain works, it can affect the way that your muscles work. There's lots and lots of different things
that can
do.
Serious,
Very, very serious. So it's very tightly regulated. And the potassium is a slightly more dangerous salt if it goes too high, and equally if it goes too low, because actually the potassium is something that's really, really important in the way that your heart is beating.
Okay.
And if the potassium level goes too high, it can actually alter the way the electrics of your heart are playing out, and actually it can send your heart into different weird rhythms.
Sure.
And occasionally it can be very detrimental, and the hearts can stop with very, very high potassiums, and I've seen that.
So this is really reinforcing the importance of keeping your kidneys healthy.
Keeping your kidneys healthy, exactly. So when we say kidney function, when we're testing kidney function at a GP surgery or in the hospital, we look for the sodium, we look for the potassium, and then there's also we also look for some of those those poisons that we talked about. They're not all poisonous, but if they're built up enough, they're detrimental, and we measure those and see how much of those. And what we do is we basically see, is the filter effective or not? If your filter is effective, you should have a perfect numbers of these things in your blood, and we do a blood test for that. If those levels are going up and down, or you're noticing that actually these levels are not in the normal range, then it can be a sign that actually your kidneys might not be working as well as what we externally think.
Okay, so we've talked about wear and tear, and we've talked about the sort of the salts and the function of it. What else could go wrong with them?
So over time, so wear and tear is one thing that we've talked about, but there are other processes that at play that can actually cause damage to your kidneys. One of them is actually your dehydration level. So if you become dehydrated, your kidneys take a hit. It's a punch to your kidney. It can take them a few days to a few weeks sometimes for them to get back on track.
Okay. So would you start to have symptoms by then?
Normally you don't.
Oh, okay.
No, so sometimes you don't, which is the sad thing, because you don't tend to feel that you've got a kidney injury.
Right.
We call it an acute kidney injury, which just means there's an acute damage, a sudden damage to your kidneys that's happened over a short period of time. Normally it's reversible, and it will reverse, and your kidney's function will go back to normal if you've got a normal young kidney in the first place. Over time, sometimes repeated injuries can cause longer term problems, and actually it might not ever get back to its normal function again. It might have to just be slightly less than it was, but over a lifetime that number can slowly decrease if we keep giving repeated insults. Other things that can affect the kidney function are things like medications. So some medications that we give you can actually affect your kidneys and make them worse.
Any specific areas of medication, or is it so vast that you just have to read the labels and if you looked at most labels, they'd say that there's, kidney function is important, not just because those drugs can affect the kidneys in terms of how they're working, but also some drugs are actually really important to understand, because the only way your body gets rid of them is via the kidneys. So if your kidneys aren't working properly, then that drug is going to be running around in your blood for a lot longer than it should be. Because if it was ideal on the labels, if you've got normal kidney function, those drugs will be out of your blood by this time, and then you can have your next dose. But unfortunately, sometimes if those drugs are running around in your blood and your kidneys aren't working very well, they're not going to get filtered out, and they will stay in your blood for a lot longer, which means you can actually kind of overdose on certain drugs. So you'd imagine the doctors checking those things before they're giving the medication dosage, and they're assessing the dose before. So
some medications we need to do that. Like, for instance, things like morphine. and some drugs that lots of people are on long term for pain relief. We need to check their kidney function before we put those on those drugs, because we need to make sure that if the kidneys are not working properly, we need to lower the dose.
We're coming to the last 3-4 minutes before the break time, and I wanted to ask you about smoking and the kidneys and diabetes. We only get one in, and then we'll have to come back to that after the break. But what about smoking? That might be the quickest one to talk about.
So smoking, I mean, smoking is detrimental to your health, full stop. Every single organ system that you can think about will be affected by.
There is no benefit of smoking, is there? Other than perhaps it helps you relax or something.
No, there's no. And as a, I'm obviously completely biased because I'm a doctor, and we see a lot of people.
I'm still biased.
But it doesn't matter whether you're biased or not. I think ultimately the evidence is very, very clear from decades and decades of research and medical literature that smoking is bad for you, full stop. And it's precisely because of the damage it does to organs like your kidneys, isn't it? So the damage, to be specific, because some people go, oh, it's just fine, like, you know, we don't understand, but we do. The smoke that you inhale through a cigarette or through a cigar or whatever however you want to do it, a pipe, those chemicals and toxins go somewhere. They have to go somewhere. You think you breathe it out, but you don't breathe out anything compared to how much you've actually breathed in. That stuff gets absorbed through your lungs. It will circulate in your bloodstream. There's tar, there's horrible chemicals, there's chemicals called carcinogenic, which chemicals, which basically means cause cancer. And those things, you know, even the tar will build up inside your blood vessels. They will tighten your blood vessels. They'll block your kidneys. They'll reduce the blood flow to certain organs. And those things, including your heart, and all those things combined, it just means that you are putting yourself 5 steps behind everyone else at the same age level. It's going to be a detriment to your health, and you're putting yourself in a dangerous position. I know there's so much more we could talk about smoking, and also we have to look at what the challenges people have in giving up smoking. I think that's a programme in itself. Completely. We're going to have to come back to another time, but I think we're coming up to the break time now, and I think after the break it'd be really good to talk about how kidney function and problems linked to diabetes. And also I think it'd be good to talk about kidney stones and transplants, because that's also something that we hear a lot about, and we're not always as up to date on it as we'd like to be. So thank you so much. We're going to take a short break now, inshallah, and we'll see you soon. Assalamu alaikum.